Tay Sachs disease. 1 in every 100,000 population is affected by the disease. In India, though the exact prevalence is unknown, it is the second most common lipid storage disorder among the majority of LSDs studied in India. Disease is classified as a lysosomal storage disorder resulting from a mutation in the hexa gene found on chromosome 15. This gene is responsible for producing the enzyme hexosaminidase A, which is essential for breaking down of a lipid GM2 ganglioside. However, in the absence of hexa, the breakdown process is impaired, leading to an accumulation of GM2 ganglioside in the central nervous system. As a consequence, nerve cell degeneration occurs, causing the symptoms associated with the disease. There are 3 types of Tay Sachs disease: infantile Tay Sachs disease, juvenile subacute Tay Sachs disease, and late onset Tay Sachs disease. The symptoms are progressive, which includes clumsiness and incoordination. Degeneration of the optic nerves may occur, hearing loss. Some children may have retinitis pigmentosa. Children tend to experience a progressive loss of speech, life skills, and intellectual abilities. Affected individuals may or may not develop a cherry red spot in the eyes, and affected children become less responsive to their environment and surroundings. Onset of the disease may vary from the late teens to any time in adulthood. This variability may occur even within affected members of the same family. For example, in a given family, one person may have symptoms in their 20s, while another reaches into their 60s or 70s with relatively mild or minor symptoms. The disorder progresses much slower than the infantile or juvenile forms of the disease. The diagnosis of Tay Sachs disease may be confirmed by measuring the enzyme activity levels of hexosaminidase A from blood serum, leukocytes, tears, and body tissues. Molecular genetic testing for mutations in the hexa gene. And prenatal screening based upon specialized tests like amniocentesis and chorionic villus sampling (CVS). Carrier testing for Tay Sachs disease can be accomplished from a blood sample and determines whether an individual carries one disease-causing copy of the hexa gene. There is no approved treatment for Tay Sachs disease. Treatment is directed toward the individual symptom management. Addressing these symptoms may involve a collaborative approach, with a team of specialists, such as pediatricians, neurologists, speech pathologists, audiologists, eye specialists, and other healthcare professionals, working together to develop a comprehensive treatment plan for affected children. Affected individuals and their families are advised to seek genetic counseling, which can provide valuable information and support in understanding the condition's inheritance patterns and potential risks. Tay Sachs disease can have varying effects depending on the age at which it appears, with distinct manifestations in infantile, juvenile, and late onset cases. Nonetheless, the disease is characterized by its continuous advancement over time. Detecting the condition early and starting treatment at the onset can help alleviate its impact on the affected individual, providing some relief and improvement in managing the disease's progression. So don't wait and get yourself tested with V-Genomics, for a better understanding of your genetic insights.